The male reproductive system contains the external genitals, the penis, testes, and the scrotum, and internal parts including the prostate glands, vas deferens, and urethra. A man's fertility and sexual traits depends on the normal functioning of the male reproductive system as well as their hormones released from the brains. Organs and function. The male reproductive system is responsible for reproduction. It's made of the following parts. Penis, the organ used to urination and sexual intercourse. It's a spongy tissue which can fill with the blood, cause an erection. It contains the urethra which is carrying both urine and semen. Scrotum, this is a loose bag of skin, hangs outside the body behind the penis. It holds the testes in place. Testes or testicles. This pair of egg-shaped glands that sits in the scrotum on the outside of the body. They produce sperm and testosterone, which is the male sex hormones. Epididymis, this highly coiled that lies at the back of the testes. All sperm from the testes must pass through to the epididymis, where they mature and to start to swim. Vas deferens, this is a thick walled tube joining the epididymis. It carries sperm from the epididymis up to the prostate glands and urethra. Prostate glands, a walnut-sized gland, sits in the middle of the pelvis. The urethra runs through the middle of it. It produces the fluid, secretion, the support, and nourish the sperm. Urethra, this is a tube extend from the bladder for external opening end of the penis. The urethra carries both urine and sperm. Seminal vesicle, this is two small glands above the prostate glands that make up much of the fluid semen.
Good morning everyone. So as you can see for today, I will discuss the function, the diseases, and how to avoid the disorders of the penis. Penis is the male organ used in sexual intercourse. It has three parts: the root, which attaches to the wall of the abdomen, the body or shaft, and the glans, which is the cone-shaped part at the end of the penis. The glans, also called the head of the penis, are covered with a loose layer of skin called the foreskin. This skin is sometimes removed in a procedure called circumcision. The opening of the urethra, the tube that transports semen and urine, is at the tip of the penis. The glands of the penis also contain a number of sensitive nerve endings. The body of the penis is cylindrical in shape and consists of three circular-shaped chambers. These chambers are made up of special sponge-like tissue. This tissue contains thousands of large spaces that fill with blood when the man is sexually aroused. As the penis fills with blood, it becomes rigid and erect, which allows for penetration during sexual intercourse. The skin of the penis is loose and elastic to accommodate changes in penis size during an erection. Semen, which contains sperm, is expelled through the end of the penis when the man reaches sexual climax. When the penis is erect, the flow of urine is blocked from the urethra, allowing only semen to be ejaculated at orgasm. Let's go to common penis diseases. The first disease is the balanitis. Happens when the head of your penis becomes irritated and inflamed. You're more likely to develop it if you are not circumcised. The symptoms of balanitis include foreskin swelling and redness, foreskin tightness, and unusual discharge from your penis head. How can you prevent balanitis? Preventing balanitis begins with practicing proper hygiene. To prevent balanitis, you should bath often. Take the time to pull back your foreskin and clean it underneath. Always use a condom when having sex to avoid contracting a sexually transmitted disease that can cause balanitis. The second disease is the yeast infection. This is a type of infection that's caused by a fungus. It tends to start as a red rash, but you may also notice white, shiny patches on the skin of your penis. The symptoms of yeast infection are unusually moist penis skin, a burning sensation in the skin of your penis, and itchiness. How can you prevent yeast infection? Proper hygiene can also help. It includes washing the penis and foreskin thoroughly with warm water and drying the area thoroughly, and avoid irritating soaps or perfume lotions. The third disease is the erectile dysfunction. It happens when you can't get or maintain an erection. It isn't always a cause for medical concern, as stress and anxiety are common triggers for occasional ED. But if it's happening regularly, it may be a sign of an underlying health problem. The symptoms of erectile dysfunction are trouble getting an erection, difficulty keeping an erection during sex, and loss of interest in sex. How can you prevent erectile dysfunction? Exercise regularly, keep or get to a healthy weight, avoid smoking or vaping, limit drinking alcohol, avoid using illegal drugs, and adopt better sleep habits. The fourth and last disease is Peyronie's disease. It is a type of ED that happens when scar tissue causes your penis to bend or curve unusually. A slight penis curve is completely normal, but the curve associated with Peyronie's disease is usually more distinct. It can result from a penis injury or trauma that causes scar tissue called plaque to build up. The symptoms are sharp bend or curve of the penis, hard lumps or tissue on the bottom of the side of your penis shaft or all the way around, and pain or discomfort when you get hard or ejaculate. How can you prevent Peyronie's disease? Doctors will usually prescribe oral medications when a man has erectile dysfunction and sexual intercourse is either difficult or impossible. The first step in avoiding penile injuries is to begin to use one of these medications as erections become less rigid. The woman should make sure that the vagina is lubricated. If it is not, the woman should use an over-the-counter vaginal lubricant. Having proper hygiene and diet will make the penis healthy. That's all, thank you.
The male urethra connects to the urinary bladder to the penis. Once the bladder becomes full, urine flows to the urethra and leaves of the body at the urethral meatus, which is located at the tip of the penis. The urethra is more than just a urinary duct. It also serves as a conduit for semen and sperm during sexual acts. Urinated semen travels to the urethra. The tube is not solely responsible for moving fluid. The urethral sphincter controls both voluntary and involuntary urination. This group of muscles includes both an internal and external sphincter muscles of the urethra. The bulbous muscles of the penis plays an active role in ejaculation. The urethra is comprised of four main segments. The preprostatic urethra runs in front of the prostate, and the prostatic urethra courses through that gland. The membranous urethra travels through the external urethra sphincter, while the spongy urethra travels the length of the penis and terminates the meatus at the tip of sexual organ.
Urethra disorders. The urethra is the tube that allows urine to pass out of the body. In men, it's a long tube that runs through the penis. It also carries semen in men. In women, it's short and it's just above the vagina. Urethral problems may happen due to aging, illness, or injury. Urethral cancer, a rare cancer that happens more often in men. Urethral stricture, a narrowing of the opening of the urethra. Urethritis, inflammation of the urethra, sometimes caused by infection. Urethral problems may cause pain or difficult passing urine. You may also have bleeding or discharge from the urethra. Doctors diagnose urethral problems using the different tests. These include urine test, x-rays, and an examination of the urethra with a scope called cystoscope. Treatment depends on the cause of the problem. It may include medicines and, in severe cases, surgery.
Urinary bladder and their functions. Urinary bladder is a triangle-shaped hollow organ is located in the lower abdomen. It is held in place by ligaments that are attached to other organs and the pelvic bones. The bladder walls relax and expand to store urine and contract and flatter to empty urine through the urethra. Urine moves from the kidneys through narrow tubes to the bladder. These tubes are called the ureters. The bladder stores urine until it's time to urinate. Urine leaves the body through another small tube called the urethra. How big can the male bladder get? A healthy human bladder can hold between 400 to 500 milliliters of urine, or about 2 cups, before it reaches capacity. Though a healthy bladder can stretch and accommodate larger volumes of urine, it is important to urinate at regular intervals. Some common bladder diseases in men is cystitis, inflammation of the bladder often from infection. Symptoms: pain, burning, or stinging when you pee. Needing to pee more often and urgently than usual. Pee that dark, cloudy, or strong smelling, and pain low down in tummy. How to prevent: avoid bladder irritants such as caffeine, alcohol, and acidic food. Eat more fiber, which can prevent constipation that can cause of urinary incontinence. Do also the pelvic floor muscle Kegel exercises for males. Paano makakatulong ito sa mga kalalakihan? It can help stress incontinence in men, especially sa mga kakatapos lang ng prostate surgery. It may also relieve overactive bladder and improve sexual function in some men. Overactive bladder is a condition which the bladder squeezes urine out of the wrong time. Prevention is maintain a healthy weight, get regular daily physical activity and exercise, limit caffeine and alcohol, manage chronic conditions such as diabetes that might contribute to overactive bladder symptoms. Pinaka-natural way o best way para malinis ang urinary bladder is to drink water to flush out bacteria. Drink 6 to 8 glasses daily para ma-flush yung bacteria out of urinary tract and help prevent bladder infections. Here's some foods to keep your bladder healthy. Garlic. Garlic is a natural antibiotic that has hundreds of different health benefits, been used for centuries as a medicine, at ginawa ng supplement para sa mga ayaw ng lasa ng garlic. Garlic has been shown to treat digestion issues, internal and cutaneous infection. Cutaneous infection is a superficial infection typically involving the skin, hair, and nails. Parasites and even fatigue or low energy issues and UTI. Bananas. Bananas are high in potassium and fiber, which can help encourage regular bowel movements and flush out your urinary tract. Plus, since bananas is a non-acidic fruit, they won't irritate your bladder and will give you nutrients that you need in a balanced diet. Cruciferous vegetables are some of the healthiest types of vegetable due to their cancer-fighting properties. They include things like bok choy, broccoli, cabbage, cauliflower, and radish. These vegetables are filled with vitamin C, E, K, and plenty of folate and fiber to encourage bladder health.
Orchitis. Orchitis is an inflammation of one or both testicles, bacterial or viral infections. Can cause orchitis, or the cause can be unknown. Orchitis is most often the result of a bacterial infection, such as sexually transmitted infection or STI. In some cases, the mumps virus can cause orchitis. What are the testes diseases? Most conditions of the scrotum and testicles can cause swelling, including varicocele, testicular torsion, orchitis, epididymitis, and hydrocele, to name a few. If you notice any swelling of your testicles or scrotum, contact your doctor to make an appointment. What are 5 warning signs of testicular cancer? Warning signs of testicular cancers are swelling, pain, or discomfort in the scrotum, a lump or swelling in either testicle, usually painless. 3. Pain or discomfort in a testicle, a change in how a testicle feels, and last, a dull ache or heaviness in your lower abdomen or groin. How can I improve my testicle health? There are few things you can do to keep your testicles safe and a great shape. Let's take a look. Learn how to give yourself testicular examination. 2. Wear protection when playing games. 3. Quit smoking, all kinds. 4. Eat plenty of foods rich in antioxidants.
Prostate is the vital element of the male biological reproductive system. It's about the science shape of the human. But if left unchecked, this small gland can cause big problems. Prostate cancer is the one of the most common cancer of affected people with the male reproductive organs. But the 1 in 9 people of the prostate will receive a prostate cancer diagnostic turn to the lifetime. This includes men, transgender women, intersex people, and non-binary people with biological male sex organs. The best indicator of whether your risk for the prostate cancer is the family history. You're 2 to 3 times more likely to get prostate cancer's biological father, brother, or son has a disease. Another risk factor is age. Your chances of developing prostate cancer increase getting older. Is most common after age 50 and more than half of the cases occurring in people over 65. There are some other risk factors too, including race, age, and whether you smoke. But the reality is the prostate cancer can and does affect men, all backgrounds, and lifestyle. Early stage prostate cancer rarely causes symptoms, but as the disease progresses, you may experience certain warning signs. To be on lookout for. Knowing the symptoms of the prostate cancer will help you keep an eye out for any concerning to your health. Keep in mind, symptoms alone do not indicate prostate trouble. Many symptoms come standard with aging. If you have several symptoms or have other concerns, visit a urologist. You might experience a slow weekend flow, and urine flow might start to stop beyond your ability to control it. Usually, to prostate cancer, it may be a good idea to get prostate checked. But early sign to prostate trouble is unexplained pain in the area on your prostate, especially when you're sitting down. This is also indicate a prostate infection, but only urologists just can say certain. Tumor on the prostate can pressure on bladder and urethra. So take note, if you start frequent or sometimes urgent to urinate, especially at night. You may also feel pain or burning sensation with your urinate. You know how dysuria. This condition is mostly common sign of urinary tract infection, but you can sometimes be sign of the prostate cancer. You could experience a lot bladder control, as well as problem control in bowel movements. It may hurt when you ejaculate, or you may not be to keep or dysuria. You may know this blood in semen or urine. Finally, has prostate cancer progressive may cause pain in your lower back, hips, or chest, as well as numbness in legs or feet. Of these, the survived sign of prostate cancer, but they may warrant a visit to the urologist. There's no way to eliminate your risk to get prostate cancer, but if you rush risk to development of disease, you have step lower your risk for prostate cancer. Lower your risk for prostate cancer. Get regular prostate screenings, maintain a healthy weight, exercise regularly, eat a nutrition diet, quit smoking. Prostate cancer is a serious disease, but only detection is key. Talk to your doctor about the risk factor and when or if you should be screened for prostate cancer. Sometimes as early as age of 40 is considered high risk when prostate cancer is diagnosed before in other parts of the body. About 97% of people live at least 5 years after diagnosis. So pay attention to your prostate. Knowing the warning sign can benefit your health in the big way.